Sir, we are live now. A very
Yeah,
good evening to all of you. A very good evening to Dr. Harshavardhan, sir. I will be the speaker today for our session. A very good evening to our EMCs. That's Imani and Tejaswini. Now, I request Imani to welcome and brief about Jignasa and its programs. Imani.
Hari Om everyone. A warm welcome to the first session of Ayur Anatomy, a lecture series for the first year BMS students. The exclusive sessions will be taken up by the eminent speakers of anatomy across the country for a period of 23 days. Today we have Dr. Harshavardhan B. Byalihal, Professor and HOD of Department of Rachana Sharira from RGES Ayurvedic Medical College, PG Research Center and Hospital, Rona, Karnataka. We also have Mr. Karthik, who is the national media in charge and co-conveyor, Jignasa Dakshina Pranta. Before starting today's session, let me introduce you to Jignasa. Jignasa is a pan-India platform of Ayush fraternity led by a student community of Bharat. Its motto is Learn Ayush to practice Ayush. It involves empowering Ayush students from campus to community, bridging the gap between Ayush students and policymakers as well as administrative authorities, connecting every aspect of Ayush, including students, academicians, practitioners, scientists, industrialists, and hospitals, all under one umbrella. Think globally, act locally. In last 2 decades, our efforts were to strengthen the Ayush education system and boost confidence among Ayush students. Jignasa initiated various programs in different parts of the country, from the grassroots to international platforms, through discussions, study circles, seminars, workshops, and conferences. Let me list a few initiatives undertaken by Jignasa, such as study circles, lecture series on specific topics, free medical camps, social health status survey, hands on training workshops, conferences to explore and learn unique aspects of Ayurveda, interaction with eminent Vaidyas and academicians, brainstorming sessions with Ayush stalwarts, policymakers, and key stakeholders of Ayush system, National Arogya Expo and International Conference, national level seminars, medical plans visits, pharmaceutical visits, agitations for the demands of Ayush students community, private internship program for interested students to learn with Acharya, interaction with traditional healers and visits to explore regional flora, online mock tests, social awareness campaigns on various issues, campaigns for the promotion of various social benefits, international conferences, competitions, etc. Free healthcare assistance to people through local governing bodies during national calamities and accidents, and many more. In our yesterday's session, more than 400 students joined for the live session and asked their queries regarding the subject and examination, and there are 800 plus views so far. We hope to reach as many students as possible who can take maximum benefit out of it. Vidyanama Narasya Rupam Adhikam Prachanna Guptam Dhanam. We have seen the inability of common students to afford huge amount on commercial study platforms despite their jignasa, the burning desire to learn. Jignasa is here to give a helping hand. Learn anatomy with experts. No money is needed. All we need is your immense interest to learn. Today, we have Dr. Harshavardhan V. Byalihal. We welcome you to the session, sir, and to each and everyone who is watching this. Hope you find it helpful. Thank you.
thank you. Thank you, Emily.
Thank you, sir. That was really a great insights to the work of Jignasa. Now, I would like to welcome Tejaswini, State Committee member, to welcome sir and to give a quick introduction about him. Tejaswini.
Yes, thank you. Good evening to one and all present here, respected staff and all Jignasa member. It would be my honor to speak a few words about our speaker, Dr. Harshavardhan sir. So let me begin with his academic endeavors. Dr. Harshavardhan sir completed his UG in Government Ayurveda Medical College from 1999 to 2005, PG in Sharira Rachna from SDM College of Ayurveda, Udupi from 2007 to 2010. Sir has written over 4 articles and represented himself at 10 state level presentations 5 national level presentation, and 2 international level presentations. Sir has done over 29 dissections till date. He was the reviewer of Grand Director Asian Edition 2019. Sir also has his own YouTube channel called Harsha's Anatomy, through which he has helped a lot of students, especially during the pandemic, to continue the learning process even in the absence of physical classes. The entire CNS lecture series has been uploaded in it. Sir has a Telegram channel named Sharira Rachna where various PDF books related to Ayurveda, modern medical notes, various anatomy lecture videos, anatomy model presentation, dissection parts, explanation videos are uploaded. He is now presently working as a professor in HOD of PG Department of Rachna Sharira, RGEHS, Ayurveda Medical College, Rona. It is a pleasure to welcome such a noble personality as a speaker tonight. So, on behalf of one and all present here, we welcome you, sir.
Thank you, Tejaswini.
Thank you, Tejaswini. That was great of you. Now, without wasting any time, we will be heading into our session. Sir, I request you to carry forward the session from here.
Okay, thank you. I thank Team Jignasa to considering me as one of the resource person for the today's topic, and the topic which was allotted to me is about the ear. Okay, so on this topic I have certain things to explain. Once I will share my slides, I will just brief you out what is the anatomy of ear in within 10 or 15 minutes. Then I will tell you, since it is a NCISM batch, they will be having MCQ, and many students have some doubts. What type of material we need to concentrate on the MCQ type of reading, along with the this natural and common LAQ and SAQ types of questions, right? So let me share this screen. Okay, slides are visible, Mr. Karthik.
No, sir, the presentation not coming.
Okay. Okay, share screen, no? On the share screen, and my entire screen I'm sharing it. Share system audio also. Now, now is it visible, Karthik?
No, sir, your screen is not visible.
Okay, then
Yes, sir.
then how
Sir, it
should
is visible.
I?
Sir, it is
Now is it
visible now.
visible now?
Yes, sir.
Okay, okay,
Yes, sir.
yeah,
Visible now.
right. Okay, I think it will be taking some time, or 2 or 3 seconds delay. Uh, right now, is it properly visible now, Karthik?
Yes, sir. It's properly visible here. Everything it's
Yeah.
clear, sir.
Right. Okay. Okay. Then, see, students. Here, the topic is ear. As we already in many colleges, this topic has been covered and taught to you. So I'm not going again in detail about the chapter wise what actually it is. I will brief it out. See, ear contains three main divisions in a theoretical study, right? External ear, middle ear, and bony labyrinth. Right? In external ear, again we will study in two aspects: pinna and external acoustic meatus. In middle ear, we will study as four components. One is about the middle ear cavity, second is about the middle ear contents, then its communications and walls of the middle ear. And in the inner ear, that is nothing but the bony labyrinth and membranous labyrinth. We will study about it. In external ear, we will see that this is what we have to go through. Okay, right. We have the helix, anti-helix. Okay, I can. So this is okay. This is not available. Okay, helix, anti-helix, and tragus, anti-tragus, and four fossae are there: scaphoid fossa, triangular fossa, then Simba concha and concha. These are the main parts of external ear. And the Darwin's tubercle, which I have, students kindly note wherever I have marked about the red square boxes, they are little bit important on the entrance basis, right? The Darwin's tubercle in humans are in the it is converted into Darwin's tubercle. It was the belief like this, right? Okay, this was actually presentation for other purpose, but let us brief about this. In this diagram, you can see the ear and its blood supply and what that artery is coming from. The main artery supplies from the anterior auricular branch, occipital branch, and the stylomustid artery is there. Okay, so from there the main artery supply to the external ear or pinna. And here is about the venous drainage, posterior auricular vein and a retromandibular vein. They are going to drain ultimately to the external jugular vein and to the venous circulation. And this is about the external ear nerve supply. One thing I need to your concentration that the concha and the posterior part of the ear is about from 7th and 10th cranial nerve is there. That was somewhat important here as an entrance point of view. Okay, and here the you can see lesser occipital nerve is there, no? That is a part of a cervical plexus because it need to be known at the time of the some of applied aspect. Okay, and in external acoustic meatus, after the pinna up to the tympanic membrane, the meatus is there. Meatus is a tube-like channel. That is the external acoustic meatus. This diagram may not be properly explainable, whatever the theory we will study. I will make you one diagram for here. You can see the tube is from the concha to the tympanic membrane, and you can observe here that the concha side, the means external side, the meatus is larger, and as it go to the tympanic membrane, it is narrower. Okay, and in between there is a isthmus part, that is the uh, uh, constricted part of the external acoustic meatus, which is the isthmus, which is about 5 mm distance from the tympanic membrane. Okay, and you can see that the whole length of external acoustic meatus, externally it is a cartilaginous and internally it is a bony, and 8 mm and 16 mm cartilaginous bony respectively is a length, and total 24 mm distance is there. And the skin of the cartilaginous part of the external acoustic meatus contains one modified sebaceous glands. Here they are called as ceruminous glands, and they contain hairs there. Okay, so ceruminous is a wax glands. Okay, so this is a brief about the external acoustic meatus, right? And wax will be removed by the dissolvent, and this is other purpose. I'm not going in detail here. One thing is important: boils in the nose or ear are very painful. The reason is the skin is directly adhered to the bone or cartilage here. When the boil separates the skin from the bone or cartilage, it will be very sensitive. The pain sensations will be more on the periosteum and the perichondrium. That will lead to lot of pain. Okay, so the reason may be important as an entrance point of view here. Okay, students, you can also note this very short points which are may help you at the time of MCQ type of preparation. This much subject is needed there. Okay, so short explanation regarding the external acoustic meatus. I have made a compilation here, and you can take a screenshot and read about the external acoustic meatus. And these are the some area where from MCQs are going to come. Next is about when we speak about the external ear. Here the pinna, external acoustic meatus, and the tympanic membrane all together will form one thing. The tympanic membrane, any tube-like structure are covered by membrane, it is called as a tympanic membrane. This tympanic membrane is called also primary tympanic membrane. Again, there will be another inside a tympanic membrane called a secondary tympanic membrane. Okay, so tympanic membrane is dimension, you can see 9 by 8 by 9 or 9 by 10 in the dimension. And a tympanic membrane is 55 degree to the external acoustic meatus. This is entrance point of view, it is important to know. Okay, the parts of tympanic membrane already you know that. Above the anterior and posterior malleolar fold, the area of a tympanic membrane is a pars flaccida or flaccid part of tympanic membrane, which is also called as a Sharpel's membrane. You should know this one, it is MCQ point important. Below to these folds, the whole big area of the tympanic membrane, which is a tensed part, so called as a pars tensa, right? And the central point of that tympanic membrane, the handle of malleus is attached from inside the middle ear. The maximum convexity will be there, and that point is called as umbo. This is also important point for the entrance. Umbo is the maximum convexity of the tympanic membrane viewed from the middle ear, not from the external acoustic meatus. But from the external acoustic meatus also we can visible, since tympanic membrane is a translucent membrane. Here important point, one thing is to know, is a cone of light. Cone of light is not any structural part of the tympanic membrane. It is a light reflection when we see the tympanic membrane. At the structure of tympanic membrane, there are three layers are there. Outer layer, cuticular layer, which is actually ectodermal in origin. Fibrous layer in the middle is a mesodermal in origin, and internal mucous layer, which is a endodermal in origin. Okay. I'm not going all these things because it will become again a lecture class. And for the tympanic membrane, this much material is needed as an important point of the entrance point of view for MCQ. You can take a screenshot later, you can see them. Middle ear. Okay, in the middle ear, important here is about MCQ point is about the distance of the dimension of the middle ear at the roof, at the center, and at the floor level, and anterior-posterior length. All these are important. 6 to 4, 15 mm in distance of the middle ear dimensions. Okay, and the content of the main content of the middle ear are three ear ossicles, malleus, incus, and stapes, right? And the three cavities also you can see their dotted lines are there. Behind the tympanic membrane, it is a mesotympanum or tympanic cavity proper. Above to that, that is a epitympanic cavity, and below to the tympanic membrane, it is a hypotympanic cavity. These are the three cavities of the tympanic middle ear, or it is also called as a tympanic cavity. Middle ear is also called as a tympanic cavity, right? Ear ossicles parts also you should know, because there are little bit importance about the entrance point of view. Malleus is attached with the tympanic membrane, and stapes is attached with the inner ear, and in between there is a connection is by the incus. Okay, and the malleus and incus are making a synovial joint, and the incus and stapes will making the synovial joint. But here we should know that between the malleus and incus and malleus, it is a saddle type of joint, and between the this incus and the stapes, there is a ball and socket type of joint. This will become an entrance point of view important. Okay, then the wall of middle ear, that is also very important. The wall communications are there, which I will show you later. Anterior superior wall, there is a tegmental wall. You can see tegment wall is there, and above there is a brain is there, separated by the a thin plate of bone called as a tegment bone. The superior roof is also called as a tegment bone. Okay, separate aspect. And the floor is there. Below to the floor there will be the internal jugular vein bulb will be there, so it's also floor is also called as jugular floor, jugular wall also. In anterior wall, there will be two openings, semicanal for the tensor tympani, and the auditory tube opening will be there. And the internal carotid artery will come on the anterior wall. So the anterior wall is also called as a carotid wall. And anterior canaliculi will be also there. Posterior wall, there will be one big opening called as auditus, which is related with the mustard anterman connect to the mustard air cells. Along with that, the pyramid is there, which gives origin for the stapedius muscle, and below there is a posterior canaliculi will be there. This is a medial wall where the promontory, which is bulged apart due to the there is a presence of a concha will be there, and oval and round windows are available on the medial wall. Okay, and the lateral wall is also called as a membranous because it has a tympanic wall. This is also called as a tympanic wall or membranous wall. Okay, so this is how in the all together will look like. This is another diagram where we can see. I hope you have studied about the different walls of the middle ear: superior, inferior, anterior, posterior, medial, and lateral. Those are also called. They're typically they are named. The other names are also important, like the tegmental wall, jugular wall, carotid wall, mustard wall, labyrinthine wall, and the membrane wall. To these names are also important, and their relations are important here to know. Okay, in the middle here, I have made some points here. We can note this one or take a screenshot for the MCQ purpose of study. Okay, these are the names of the different walls and their brief content, which are most important for the MCQ. Only those are I have collected here. Internal ear, this is called as a labyrinth also, and there are two: bony labyrinth and membranous. Outer there is a bony, inside there is a membranous labyrinth are there. Bony labyrinth have cochlea, vestibular, three semicircular canals, and inside the same area we call them as a cochlear duct, sacral and utricle, and three semicircular ducts are there. In the bony labyrinth, we will see three parts: concha, vestibule, and which we have seen the semicircular canals. Right, the same thing is here. And in the concha, main thing one should know is about the modulus. Is the center part of the bony part. Hard bony part is a modulus of the concha is there. Okay, this is a cavity inside the membranous, and here you should know that concha not only one tube, it contains a three tube inside. One is a scala vestibuli and the scala tympani. Important here to know that scala vestibuli and the scala tympani contains perilymph, and scala media, which is there inside of the cochlear duct, which is filled with the endolymph. And where the scala vestibuli and the scala tympani connects both together, which is called as a helicotrema, and scala vestibuli is closed by the stapes foot, and scala tympani is closed by the round window by the secondary tympanic membrane. I told you, no, there are two type of tympanic membranes are there. This is a secondary tympanic membrane which closes the scala tympani. There is another tympanic membrane proper at between the external acoustic meatus and the middle ear, that is also called as a primary tympanic membrane also. Okay. Next, about the membranous labyrinth, already you know that in the cochlea it is a cochlear duct. In the vestibule, there are two things are there, saccule and utricle. And in the semicircular canals, there are three semicircular ducts are there respectively. And where the succulent utricle, where the cochlea and the saccule meets, that the connection is called as a ductus reunions. And where the succulent utricles meet, that is called as a sacculo-utricle duct. And that sacculo-utricle utrico-saccular duct descends downwards and called as a endolymphatic sac. Okay, so this is about this thing. And you should one thing here, the cochlear duct will send a sensation of hearing. Saccule and utricles related with the static equilibrium, and semicircular ducts are related with the kinetic equilibrium, and both together will form the balance of the body. Okay, so this is a some clinical aspect which I'm not going in detail about it. See, these are the some very important points related with the cochlea which are important for the entrance point of view. You can take a screenshot of these things. This is about the cochlea, and this about the vestibules, and about three semicircular canals. And some details are there which you can take a screenshot. Later we can discuss, and you can ask question related to this. Okay, for this one, thank you for Sushrutas, good hearing. And related with the examination point of view, you know that there is a uh, sensory organs in the theme G, what in the NCSM, no, in the theme G, there is a sensory organ is there. From this one, MCQ, SAQ, and LAQ, all three are mandatory, are there. In them, one question from a sensory organ will come from the desire to know component of your syllabus, and one question from must to know component. Here which one, whether the desire to know questions will not come from the 10 marks, usually they will come from the 5 marks, or one question in the MCQ from the desire to know component, and one question from the must to know part is there, which may come from SAQ or LAQ. Okay, these are the some points which I have mentioned already. And yesterday, when I have heard about the lecture series, and first one, Guraj sir, we were discussion, and many students are asked what type of drawing we can draw in the examination related with the anatomy. See, it is not possible to draw as it is there in the textbook. Forget about it. You won't follow the time also. So these are some examples I'm showing you from in here. If you have the option to draw, these are the options you can choose to draw the diagrams. Here the middle wall, no wall of the middle ear, the main headache for the students to write, and the diagram of internal ear. See, as Sir also rightly mentioned, you may not go for the as you see, every student cannot become an artist. Anatomy, if it is visible for the lecturers who are evaluating, you know that they are teaching anatomy since from more than 5 years or 10 years. They know what subject it is. They want they want to know that whether student know the subject or not. If evaluator convinced this is what it is about, it looks like an internal ear, it look like a tympanic membrane, it look like a ear, that's more than sufficient. And then there should be some anatomical points should be there. Okay, so this is about it. Okay, so here the about the PPT is over. Now I will stop sharing this slide, and I will come online. Okay, this is about this one. If you have any doubts related to these things, whichever, how much ever I have understood, I have told you. If you have any query, you can ask. Related with MCQ or related with the SAQ or LAQ. See, here is a one subject here which is very favorite for the LAQ and SAQ type. In external acoustic meatus or external ear, middle ear and internal ear. In the previous examination, these questions were asked for 5 marks are also and 10 marks also. Okay, so there is nothing called that this one is not important. Here the three component of ear are all important here. Okay, so if you want to know what to write in the external ear, then it should contain pinna, it should contain external acoustic meatus along with the tympanic membrane. All three things should be there. See, when you are writing, okay, there is a question. Can they ask only one part of the year for 5 marks? Yes, definitely, definitely. In the they can ask for 5 marks. Either anyone. There it may be the external ear or middle ear or internal ear. Okay. For if it is a question for the external ear, then you have to add three things. Pinna parts you should mention it. External acoustic parts are also you have to write, and tympanic membrane diagrams, small diagrams. No, they are not difficult diagrams at all. If you write everything, if you cover everything, that will be good. In the middle ear, I have told you, four components you have to mention in the sequence. One is about the cavity, then content, about the wall, and communications. If you write in the brief about these things, middle ear is fine. Along with that, you need not to write about the ear ossicles in detail if it is question for the 5 marks. Okay, if it is for the 10 marks middle ear, then you have to little bit add like 1 2 diagram more, and you have to explain about the ear ossicles. And then internal ear, then it is very easy. Bony labyrinth and membranous labyrinth together and their functions, if you write, is sufficient. Whatever I have told, that most yeah, the material is sufficient for the explanation. Then any doubts are there related with MCQ or LAQ or SAQ? If you want to discuss, I will be available. No issues. You ask doubts so that you provoke me to tell me more.
I guess they are typing, sir. We will wait for another 5 minutes, and they will be
It's okay. It's
sending
okay.
in the questions.
Done, done. Thing is, when you provoke any teacher about the doubts, no, they will tell you whatever you wanted. More than that, they can add up something and they can explain you in a very better way. Meanwhile, I will tell you a little bit about the MCQ point. So, what you should concentrate on the MCQ, not only related with the ear, any part of the anatomy. One thing is most important is about the numbers. Wherever the numbers will come, no, all numbers are important. Okay, and the single word, the anatomical term has a alternate name followed by any scientist name, which does not will come to our common sense. Okay, I have told, no, pars flaccida of the tympanic membrane called the Sharpnell's membrane. There is no other way other than the by hearting. You have to by heart it, and you should know it is called for this one. Okay, so for MCQ, lengthy reading is not required. The sharp reading is required. Only one word or two words are there. No, those are important. And different names of the structure, those are important. Like auditory tube, it is also called as a pharyngotympanic tube and Eustachian tube. There are many names are there. Okay, those are important. And the content of middle ear, those are important. And the communication, posterior communication, anterior communication, where they will communicate related to some of the examination point of view. Also, it is the examination, clinical examination also. Blood nerve supply is important. Okay, mentioning about the blood and nerve supply is important or not? See, it depends on the type of question. Okay, if question is for the 10 marks or LAQ is there, then you need to write about the nerve supply. See, nerve supply to external ear, that to pinna is not that much important, but is external acoustic meatus nerve supply is important since it involves a vagus nerve. And clinically, when the vagus nerve is stimulated at the time of wax removing procedure, if that patient condition not known about the heart condition, many patient will collapse on the table while removing the wax. Okay, so that's why it is important to know about the nerve supply. Not middle ear nerve supply is not important. And nerve, which nerve is related with the middle ear and internal ear? That is very depth question. It will comes under the nice to know part. The must know part is not much important. Mentioning about the blood and nerve supply related to ear, that is not much important. Okay, there was one question which came in mind. Sir, is there any pattern like 60 marks from Ayurvedic and 40 marks from the modern related to ear, or generally whether it is a general question?
General question, sir.
Pattern. It's a general question like 60 marks from the Ayurveda. No, 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 no. If you go with the, see, NCASM clearly, see, except giving a question paper, they have mentioned everything in the syllabus. Okay, if they have mentioned this marks should come from this syllabus, that marks definitely will come in the examination this time. So no doubt in that one. If how much marks is allotted for Ayurveda and modern, how cumulatively I did not see, but how much marks is mentioned about this particular syllabus is there, no, that much marks will come definitely, sure. That is for the sure. Not like in previous, like modern this much and Ayurveda this much, they have particularly mentioned how much it will come. Sir, which part of the ear converts sound wave into vibrations? Tympanic membrane. Tympanic membrane actually vibrates, and that vibration will be carried to the malleus. Then that malleus will carry to the incus and stapes will push the internal ear, the scala vestibuli, and there is a perilymph is there. That liquid will get altered, and due to that, there is inside the uh, cell organ of Corti, hair cells are there, they will move. When the organ of Corti hair cells moves, that will create a action potential which will be conducted as a sound wave. Okay, so it is a mechanic movement of the tympanic membrane which will be carried through the ear ossicles to the internal ear, which is a part of ear canal. Describe the pathways necessary in LAQ. No, 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 no. It is not necessary. Not necessary. If you mention that vestibular nerve is related with the vestibule, which is related to the balancing of the body, and cochlear nerve, which is related to the hearing part of the body. That is much enough. Even other than the question, if it is asked how it is conveyed, so pathway is a part of a physiological questions, but not will not come under the anatomy also. Even the question is there from the CNS about explain about the vestibulocochlear nerve as a part of the CNS, then you need not to mention about the pathways. You can mention about the anatomy from where to where it is going to convey, through what route. That's more than sufficient. Pathway is not necessary. Pathway comes under the physiology. Others. Expected for LAQ from arthrology. Arthrology, joints, you're asking. One is about the type of joint in general, and major four joints are important, or five joints are. One is a temporomandibular joint, elbow joint, shoulder joint, hip joint, and knee joint. These are the most important joints for the examiner. One is general type of the joint, and these five joints. If you study this much, is more than sufficient. Okay, and wrist joint and ankle joint, some question paper are there, but that much depth may not come this time. Expected for LAQ from arthrology. No, the same thing which I told. Arthrology from these are the clinical anatomy. Naming a few disease is fine, or a small explanation is required. Again, Linda, it is depend on what is the length of your answer. See, whenever you are writing about the, see, if it is a 5 marks question in the applied anatomy, if you write name of particular name, for example, if you are writing about the radius and all that, and you are mentioning about the Colles fracture, more than sufficient, need not explain what is Colles fracture. Okay, but at the time of the same thing about the elbow joint, if you write about the student's elbow as a student's elbow is a name, then you have to mention about the olecranon bursitis. That is small explanation, a single word explanation is there. That much is sufficient, not a whole paragraph you have to explain. No, that is not needed. Does what if we fail more than two subjects, what is the criteria? See, why you want to speak about the failing, man? Be positive. Okay, see, there are three departments in the first year. There is Rachana department, Kriya department, and Samhita Siddhanta department. Okay, in Samhita Siddhanta department, you have Sanskrita, Padartha Vijnana, and the Samhita Adhyayana, right? See, in these three departments, so here it includes Siddhanta department, three subject altogether one, and Kriya one, and Rachana one. You need to pass two-third of the papers, right? Either you have to clear all the Samhita Siddhanta department and the Kriya department to qualify second year. Okay, so this is how it is there. Two-third you have to pass, and within four attempts. And many expected questions from the myology. This is one thing, Surabhi. See, myology is one area where every student will study very detailedly, but the questions will not come from the myology usually. And for the NCISM, I have seen that uh, it is maximum 5 marks question will come, not at all the 10 marks, just like a previous. Okay, in previous question paper, the upper limb muscles explain. This is a one question was there in previously, but that much question will not come in the this time in NCSM. If it comes in the theory, it will come only maximum 5 marks. And if you can concentrate, if it is that, then the pectoralis major, deltoid muscle, larger muscles I'm speaking, pectoralis, deltoid, biceps muscle, that's it. On that, some of the group muscles like flexor muscles of the hand, and hamstring muscles of the leg, those are only thing. Original insertion, that will not, theoretical I doubt it will come this time, but entrance point of view, for MCQ questions may arise from the biology. 10 marks, forget about it, is not, will not, LAQ will not come from the biology. 10 marks, no. Only 5 marks, large muscles, like very nervous system, LA question and answer. Okay, the nervous system is one thing which we need to take lot of time. I usually teach nervous system more than 3 months, but only question will come on maximum 10 marks. So not much questions will come from the nervous system, but whenever it will come, two things are you need to mention. 10 marks LAQ questions are, one is a spinal cord, another one is a cerebrum. These two are the area, and another one is a brainstem. If these are the three questions collectively come for the 10 marks, cerebrum, spinal cord, and the brainstem, these collectively will come for the 10 marks. For the 5 marks, the superficial part of the what is this, cerebrum, cerebellum, and individual brainstem parts like pons, medulla oblongata, and the midbrain. Midbrain will not come. Usually, medulla oblongata may arise. Then for 5 marks, cranial nerves collectively may ask you for 5 marks together to mention about which one is a sensory, which one is a motor, which one is a mixed, and very important to know is about the order. Then their origin points. Cranial nerve important is about from where they are going to origin from the brainstem. That is important. Other than the optic and the olfactory. Okay, nervous system has only 14 marks, but how do we study the entire concept and what has to given the importance? This is one very important headache part from the students. See, I don't know why our brain does not understand ourselves. The brain, it is somewhat thick is nervous system as I understood. This is not one syllabus point in the whole anatomy, which will be understood by self study. Okay, that has to be dealt by a teacher and learned from by the students. How much ever you try to understand by your self study, it will lead to little or some problem in understanding. In nervous system, don't go in a depth. For I'm only speaking about the entrance, the examination point of view, not about the knowledge point. Knowledge point of view, and if you do not know about the CNS, is a crime, because tomorrow you are going to become a Ayurvedic doctors, and the main thing you are going to deal with the Vata Vyadhis. And if you don't know the CNS, it is a crime again in your future. But for the examination point of view, the question will not come much depth wise. Okay, the very famous questions were there, no, limbic system or those only questions will repeat once again. I doubt there is any depth questions will come from the CNS this time. If it will come, cerebrum or brainstem or spinal cord for 10 marks. That too, I doubt it this time. 5 marks like thalamus, limbic system, or any part of the brainstem, or any part of the spinal cord or cranial nerves, like that they will ask. Getting fear, sir. Why you want to get feared? See, anatomy is not a subject to detail. If you study in front, when the exams are nearer, and if you are reading just like a knowledge purpose nearer the when exams are near, that is you are making a mistake, Srinivas. See, when you are nearer, you should know everything. Not, at least not in a detail. I should know that this is where I know the topic from. Okay, and make sure that you can make a gross concept of writing the answers. If questions are there like in any organ, what are the headings you will mention, and subheadings, and one diagram, that is enough. Okay, so here in examination, no, there will be time bounded writing is there. The whole day you are not there to write the answer. Within 3 hours, whatever it is asked in the exam, in the question paper, that you have to write it. But to write one answer for 3 hours, it's a no, it's not good. So within a time limit, you have to write it. For 5 marks question, within 7 minutes, you have to complete your answer. If it is not completed, leave that answer and skip and go for the other answer. So that once you attempt all the questions, for 10 marks question, maximum 13 to 15 minutes. More than 15 minutes, don't spend time on the LAQ. And more than the 7 minutes, don't spend time on the SAQ. Okay, and 1 minute for the MCQ. If you do that one, within a 2 hour 15 minutes, you will be attempting all questions. Then you will be having 1.5 hour or 1 hour properly. Then you can write whatever the left out part is. Okay, so another one question, many my students are there asking me that, sir, is it necessary to write three pages for 5 marks and 6 pages for 10 marks? That is not at all necessary. Okay, whatever the question asked for, if you have written that much in a very brief and very convenient way, and you are not irritating the evaluator to read your answer, that is more than sufficient. They will definitely give you marks. See, evaluators are there to give marks, not to cut the marks. You should not irritate the evaluators, that's it. Okay. For an Ayurvedic concept, question can we use modern parts? See, definitely. See, I don't know. Many students are writing just like they are writing not an answer. They are writing the textbooks in the answer paper or notes in answer paper. For example, for this question, I will arise a question and I will expect what you will write, and I will tell you what to write. Okay. So one thing on the Shuddha Shukra Lakshana, 5 marks is there. Many times this was asked. Okay, and Shuddha Artava Lakshana is a one question which 5 marks is there. What you write? Spatikapam Snigdha Madhura Madhura Gandhicha, that two lines shloka you will write and its meaning you will write, and you think that you have written every part of it. No, there's a, and you think that 5 marks you are going to get from this answer. Any evaluator will give you 2 marks, not more than 2 marks. Okay, so what to write? See, whatever the concept of Ayurveda is there, the whatever it is asked, you mention the shloka for that and the theme of it. Okay, theme or meaning of the don't translate the shloka, write the theme meaning of the shloka, then write next to discussion, and in discussion part you take one or two or three parts, depends on the lengthy questions. If it is LAQ or SAQ, if it is LAQ, then you would choose over 4 to 5 points to explain. If it is a SAQ, 2 or 3 points you take and explain the things. You can add modern parts there. There you can add. Lastly, write a conclusion, and what you are the whatever the conclusion will come, no, that you mention. Then it will become an explanation part, and that will become an answer. If you write, for example, no, Masana Masika Garbhodhi Krama, it's a very sure question. It will definitely come. Many times it has been come in the examination. And for Masana Masika Garbhodhi Krama, every from Prathama Mase Shloka meaning, Dvitiya Mase Shloka meaning, Tritiya Mase Shloka, and up to ninth month. And 1 hour, 1.5 hour, how it will went, you don't know. Okay, so that is, if you do that one, no, you will kill the time. No, that is not the way to write the answer about it. Okay, so mention shloka first and brief meaning of that one, then describe actually what that masanu masika refer for, and write the conclusion that whatever the Masana Masika Garbhodhi Krama it is there, that is an observational, and Sushruta has observed like this, and Charaka has observed like this. Whatever the question asked for, no, that mention related to that, you need to write the conclusion and the description. I hope.
For answering so many questions related to you and out of the topic also, sir. It's
That's
really
what.
generous. Yes, sir. It's really generous of you making time to answer every question, sir. I really
Hmm.
thank you from my side, sir.
Yes.
Shall we wind up the session, sir? I will ask Tejaswini for vote of thanks.
Thank you, Karthik.
Tejaswini, now I call upon you for vote of thanks.
Yes, sir. On behalf of our entire Jignasa team, I would like to extend my heartfelt gratitude to our speaker, Dr. Harshvardhan sir. This session was full of knowledge, and the students happened to receive many insights of the topic here and clear their queries on how to present it in the paper in terms of MCQ, SAQ, LAQ, and diagrams. Thank you so much, sir.
Thank you.
Uh, I would like to thank our Jignasa Central team for their constant support and guidance. Thank you all, viewers, for your patience and staying up till the end. You can also visit Dr. Harshvardhan sir's YouTube channel for further more references regarding anatomy. So, with this, I
Definitely.
would
Yeah.
like to conclude today's
Thank you.
anatomy session. Thank you so much, sir. Thank you.
Thank you.
Thank you, sir. Thank you for joining. Thank you, guys, for everyone who have joined. Uh, we will be hosting the sessions every day for the next 20 days. Keep visiting our YouTube channel frequently to know the regular updates, and follow us on Instagram at Jignasa Karnataka to know about what topic will be up next. Thank you, guys. Thank you, everyone, for joining. Thank you, sir. Thank you, Tejaswini,
Thank you. Thank you.
for hosting this session.
Thank you.